Dr. Georgia Sheahan, and I'm going to answer a few quick questions about dentistry. We recommend you come see us every 6 months. The reason for that is that most types of dental disease and gum disease cause absolutely no pain at all and are often not visible to the naked eye. If you wait until you have a toothache or wait until something starts being uncomfortable, it's usually already been there for a really long time and it's a much bigger problem to take care of. If you come every 6 months, if there is an issue that starts to arise, we can nip it in the bud before it becomes anything significant. And of course, when you come, you're not just getting your teeth checked, you're getting them cleaned as well. When you have them professionally cleaned, that reduces your risk of getting any dental disease. Well, usually the reason for your gums bleeding is just simple old gingivitis. And some people get really stressed out about gums bleeding. Don't worry, it's usually not a big problem at all. So what happens is we all get plaque on our teeth and gums. It irritates the gums and it makes them bleed. That's their sign of inflammation. So usually all you need is for our hygienist, Samantha, to give them a really good clean and the gums settle down. One common mistake that people make is when their gums start to bleed, they think, oh, I better be careful and not brush that area and not floss that area. That's the exact opposite of what you should be doing. If your gums are bleeding, it means they need extra cleaning, not less. So if you notice the gums bleeding, make sure you're brushing it really thoroughly, flossing very carefully, and if the bleeding doesn't settle down in a few days, come see us. No, it does not. Enamel is the hardest tissue in the body, but it never regrows. Once your tooth is through the gum, it's there, that's it. It doesn't grow anymore. So any toothpaste or mouthwash or any dental product that says it can help you grow your enamel back or rejuvenate your enamel is lying to you. Do not buy it. This is a tricky one. So the official recommendation of big groups like the Australian Dental Association is that as soon as your child has a tooth, they should be going to the dentist to get it checked. As most parents know, it's extremely difficult, if not impossible, to do a proper dental check on a 6 or 12-month-old or even an 18-month-old. The age to bring them in really depends on the child. I think it's a good idea to bring them in when they're of an age where you think they're not going to get completely freaked out and that they can be persuaded to at least open their mouth for us so we can have a look. Depending on the child, it's between the ages of 2 and 3. One thing that I love when families do though is obviously the parents or the older siblings are coming in every 6 months for their checks. So you just bring Bub along with you. And if a 6-month-old baby is interested and wants to play along and join in the family appointment, then of course we'll have a look at their teeth. If they're a bit standoffish and freaked out, we'll just give them a new toothbrush and a sticker and get them just familiar with the environment so that by the time they get to age 2 or 3, they're already used to us, they're used to seeing the room, and they're not going to be scared, and they'll cooperate with an examination. I have no idea if toothpaste is gluten-free, but regardless, you're not supposed to eat it. So I'm pretty sure celiacs can just use it and rinse with it. It should be fine. This is something that depends a lot on the person and the situation. If there's nothing else wrong and no unusual symptoms or anything looking unusual, we recommend that we usually take x-rays every 2 years to confirm that we're seeing all the tooth surfaces and we're not missing anything. If somebody is what I would classify as high risk for dental disease, somebody might have underlying medical conditions, an inability to keep their teeth clean or a very high sugar diet, I would recommend taking x-rays perhaps every year or 18 months. And on the other hand, if someone is has excellent oral hygiene, is very low risk for dental disease, never had a filling, never had any problems, and their hygiene's fantastic, I might only do x-rays every 4 years. So it really depends on the person. So receding gums, or what some people call shrinking gums, is something that happens to absolutely every person always. There's nothing you can do to stop it. It happens to all of us as we get older. There are, however, things you can do to try and minimize it. One of the most common causes for prematurely receding gums is using a hard toothbrush. So make sure you're always using a soft toothbrush and don't scrub back and forth on the sides of the teeth, just gentle circular motions on the gum line. Keep it nice and healthy. The other thing that can help your gums stay healthy and not recede too much is having them cleaned professionally on a regular basis every 6 months. Another thing that sometimes causes people's gums to recede prematurely prematurely. Certain underlying illnesses, diabetes is a big one, where they tend to have gum and supporting bone problems. So again, routine cleans are really crucial. A soft brush, always a soft brush. There are absolutely no exceptions. So whether you use a manual brush or an electric toothbrush, both are fine. You can do a good job with both, but they absolutely must be either soft or extra soft. I don't even know why we sell hard or medium toothbrushes in this country. We just shouldn't. Hard toothbrushes are for cleaning the sink. They are not for your mouth. Always soft. I have absolutely no idea. It goes in landfill. I don't think anyone's recycling floss. That's disgusting.